Now, as we know, prescription tranquilizers can be used for panic attacks and anxiety, sudden grief and depression. But what about those who become hooked and become dependent on them? Dr. Chris Luke is with us. Doc, first of all, what are we talking about here? What are these pills called?
This afternoon, I thought we might talk about benzodiazepines and the Z drugs, the zopiclones and zolpidem. They're commonly known as sleeping tablets, and they're prescribed primarily as sleeping tablets. But then they're also prescribed for anxiety, as you say, panic disorder. And they're classically given for people who've had some kind of serious trauma. Bereavement is the #1 thing, and, or some sort of accident, and they've become very stressed about the whole thing. And they're given it, perhaps they're prescribed it for a few days or a few weeks, and before you know it, they've become addicted.
And this has become a very big problem.
It's a huge problem. They estimate that there's been an increase of about 40% in the use of these drugs, and of course the misuse as well, because once you get a lot of drugs being prescribed and used in the main population, the drug starts leaking onto the black market, and it starts getting to be traded on the streets. And of course, we know that sleeping tablets are a kind of substitute for heroin and the methadone and so forth. So wherever you have a problem, for instance, with methadone and heroin, you also get a problem with sleeping tablets. And we're beginning to believe and find that, in fact, many of the deaths that we've attributed to heroin and methadone, for instance, are probably finally caused by the mixture. And in fact, people die from methadone and heroin overdose because they stop breathing. And I think we're beginning to see medically that, in fact, it's the sleeping tablet part of the cocktail that has nudged them over the edge.
Okay. Let's take a look at the different brands, and I said the brand names that we would associate with these. Valium, for example, it's been around for a long time.
Yeah, Valium is the mother of, or the grandmother, the matriarch of all the sleeping tablet drugs. And Valium was actually introduced by Roche in about 1960. And it became so popular within a few years for, you know, anxious housewives in the United States that the Rolling Stones wrote their famous song, Mother's Little Helper.
That's right.
And by the late 60s, early 70s, there was estimated to be, you know, a billion pills being popped and prescribed every year. But they began to realise that it was an incredibly addictive drug, the benzodiazepines, and its cousins, you know, the Ativans and the Xanax and so forth.
Yeah, you were saying earlier on, Doc, that you can actually get addicted to this in about 4 weeks.
Well, that's the kind of rule of thumb. Now, I work in an emergency department, and we would prescribe Valium very often. I mean, some of us would call it God's gift to emergency medicine. Valium is an incredibly effective drug. And that's an important point to remember. It's very effective for convulsions, for severe muscle spasm and pain, for people who have genuine panic, for example, following, a reaction to a drug.
So it's a calming drug, really,
It's very
Doctor.
useful, but you must only use it for a very short period of time.
Now, Fiona beside you has her own story about Valium. Fiona, you take Valium and you still take it, but intermittently.
Yeah, I was prescribed it about a year ago. I mean, I've spoken on this programme before about my anxiety disorder. And my GP, who is brilliant, and he was so reluctant to prescribe it. I mean, to be very honest, I'd already started taking it because my mother has it, and she's had it since the 1960s, and she had kind of, in the great Irish way, she had slipped me the odd Valium and all that. And when I kind of went and actively looked for it, I got about 1 million health warnings, and he basically said, I am giving you 30 of these, and when they run out, you're not getting any more, so you need to go and get CBT.
And is that the way to do it, though, Chris, as Fiona was prescribed it?
Well, Fiona has just described the problem. You know, there are a lot of these tablets lying around in many of our houses. There is a kind of relaxed approach between the generations and between members of the same family and between friends. And it's also, you also have the position of the medical profession, who have been told over and over again for at least 20 years that these medications are very, very addictive, so please stop prescribing them. And there's been a lot of pressure put upon the medical profession from both the legislator side and from the customer side. So, like, you hear of a lot of GPs in the inner city coming under serious threat from patients and would-be patients looking for them and demanding these.
Not only patients, we are getting some texts and tweets in on this. Hi guys, I'm a nurse, I work nights and I've fallen into a pattern in the last 2 to 3 years of taking Zimavane, which is a sleeping pill, to sleep when I'm off. At first it was great, getting great night's sleep, and I really needed it. Now I cannot sleep unless I have it. I'm completely addicted to this medication. Any advice? Greatly appreciated, Chris. Now that's a shift type worker who has very unstable sleep patterns. What advice would you give that person?
Well, unfortunately, and I speak as someone who has been doing shifts for 30 years, shift work is very disruptive of the biological rhythms. So that's the fundamental problem she has.
Yeah, it's not the drugs, it's the shift work
exactly.
too, of course.
I suspect that this is one of many initiatives or measures she's used to deal with it. The difficulty with the so-called Z drugs and the benzodiazepines is that you develop tolerance. So you might start with 2 milligrams on day 1. By day 7, you probably need 10 milligrams to achieve the same effect, and by the 4th week, you need 20 milligrams.
So it's a vicious circle.
It's a vicious circle, and that's why it's so addictive. And unfortunately, as the ads for nicotine replacement say, willpower is required. The good news is that, a bit like cigarettes, if you give up the medication, the benzos or the Z drugs, you can regain your sleep hygiene, your sleep pattern. You can eventually get rid of that underlying anxiety.
Chris? How long? Because, you know, sleep, and I'm not a great sleeper by nature. Yeah. I know you're not either, Fiona. I mean, I'm not a great sleeper, so I'm just wondering, how long would it take for your natural sleep pattern to return?
Well, you probably need help if you're addicted to the benzodiazepines. And you have to, first of all, recognise if you are addicted, and it's something that you certainly should talk to your general practitioner about. There is a school of thought which said you should take several months. If you've been taking them for years, it may take 12 months to wean yourself off them. And actually, paradoxically, there's a suggestion that if you're on the Xanaxes or the Ativans, that you should go back to the diazepam at an equivalent dose, because diazepam is very good and that you can ratchet back down.
You're almost like a drug addict. You're coming off something.
Well, precisely.
What damage does it do to your body? Because I'm sure there must be people, particularly maybe older women, watching this who'll go, sure, I've been taking them for years and I'm fine.
Yeah. So, well, I mean, there are geriatricians who throw their hands up in despair when elderly ladies are admitted to the geriatric ward, because they say they've been on Ativan, for example, for 30 years or Valium for 20 years, and they will often say it's harder to get an elderly woman off her Valium than it is to get her off cigarettes or even the heroin, and that's a feature of the addiction.
That's one thing, Brian, I don't think people are aware of. Say, if you do take 2 of these tablets, all of a sudden a week later you have to take 4.
Yeah, that's what he's saying
becomes
there,
6.
yeah.
And I don't think people really realise that, and all of a sudden you fall into a pattern or something.
Yeah, I mean, I hadn't heard about sleeping pill addiction until I was in a rehab centre in 2005. I've written about this in the past. And I was sharing a room with a guy, and he was telling me about the number of pills he was taking every day just to get through the day. And it was about 50 pills. And colloquially on the street, they call them Smarties. Yeah. They don't refer to them as sleeping pills. I mean, that's...
And one was to get you off, the other one back. It's kind of uppers, downers, everything.
Yeah, he would take 5 to 10 to wake up, and he would take maybe 5 to 10 to go to sleep. And then during the day, he would take them for various reasons. As some wore off, he would take others. And funny, I met a doctor recently, a GP, who was telling me he's recently taking over a city centre practice, and he's reduced the prescribing rates by 1/3. And it is in an area in Cork which is of a lower socioeconomic area. There were huge pressures on the previous GP to prescribe. A lot of competition amongst GPs in the area. So it's a difficult one for the medical profession as well.
But I make 2 points about that.
Yes,
Valium and its cousins are overused by 2 groups in the population. One is the professional upper classes and the middle upper managers and so on and so forth, the well-to-do, the bourgeoisie, and the other is the lower, the more deprived parts of the city. And those are the 2 peaks. Sorry?
The sans-culottes, I think they're called.
Exactly. Exactly.
Yeah.
But a very important point we mustn't forget is that Valium and the sleeping tablets are associated with severe violence. Now, there's a paradox here. I mean, I was talking to someone about this, and they said, well, surely you shouldn't get violence because
it calms you down. Yeah.
But in fact, in a small number of people, you get the exact opposite, and you have what's called paradoxical excitation. So you get an intensely violent reaction rather than the tranquilizing or sedating effect that you'd expect. And there was a very interesting piece in the papers recently, I think quoting Dr. Marcus Kennedy, I think that's the name, he's the director of psychiatry in the Central Mental Hospital in Dundrum, talking about how the use of prescription medication had become so prevalent in the prison service, and that they'd found that, in fact, when they tried to reduce it, and they had effectively reduced it, the levels of violence within the prison service had plummeted. And I think that gives you some idea. So a lot of violence is associated with the misuse on the streets of benzodiazepines.
I just want to get through a few texts here, Doctor. A lot of anonymous texts, obviously. This is an area, of course, it's a very sensitive subject. My son is addicted to sleeping tablets and painkillers. He gets prescriptions from 3 different doctors. I have informed them that he's what he's up to, and he's managing to still get those prescriptions. What can I do? Another email here. I take 0.5 milligrams of Xanax every night for the last 15 years. If I don't take it, I would be awake all night. I have acute anxiety. Going back to the son who's addicted, what should that woman do? Surely this must be illegal if he's getting so many different prescriptions for the same drug.
The doctors probably wouldn't even be talking to each other.
Precisely, and that's how it all begins. You have a hospital hopping and doctor shopping, and that's how it works in the free market. It's a very, very difficult problem. I suppose that the mother needs to try and approach the family practitioner.
Or all three different ones.
The lead practitioner to try to start some sort of conversation about it.
But it's funny on that, because I suffer from migraines, and if I go to a pharmacy now, I have to struggle to get codeine from the pharmacist, and yet people can go to a doctor and can get, you know, large levels of prescriptions. Like, there's a real irony there, isn't there?
There is, absolutely, and the codeine is a bit of an excessive backlash.
Dr. Chris Luke is with us, of course. Doc, we have a text in here. My sister was admitted to hospital yesterday. She's 52 years of age and she's addicted to prescription drugs. I don't understand how her doctor could allow this to happen.
Well, I think, Dolly, we heard about the young boy going to 3 separate doctors, and that's how it begins. One way or the other, people are ingenious enough to get what they want. And people do actually put a lot of pressure on their family doctors very often, and sometimes the doctors just cave in under the pressure of work. They only have a few minutes to see each patient. So I think there's an element of that. But there has been quite a bit of a reaction on the part of the regulators and the medical profession and the colleges and so on and so forth. And certainly in the discipline of general practice, there's a huge initiative afoot to reduce the number of Valium and other medications like that being prescribed.